Good afternoon, everyone, or for those of you on Central or Pacific time, good morning. My name is Mark Skidmore. I'm the director of the North Central Regional Center for Rural Development. I'm also serving as the coordinator for the Extension Opioid Crisis Response Workgroup. The work group has been charged by ECOP, that's the Extension Committee and Organization for Policy, to to help develop a strategic plan for extension in addressing the opioid crisis and more generally behavioral health. And so we've been working on that in two tracks. One is sort of the long-run framework, and then this track that we're working on right now is to provide some information regarding opioid programming being used by Extension around the country, so that others who are interested in perhaps doing this kind of work in their own state would have a sense of the different types of options they have that would be a good fit for them. And so with today is the first of a series of webinars, and we have Dr. Courtney Cuthbertson from Michigan State University, and she's going to be talking about community-based opioid awareness programming that has been developed here at Michigan State University. And so, Rosa, if you would just bring in the PowerPoint for Courtney, that would be great. Dr. Cuthbertson is a community behavioral health specialist at Michigan State University Extension. She's trained as a sociologist in mental health. And so the title of her presentation is The Opioid Crisis, What is MSU Extension's Response? And also what we really would appreciate, and as we come to the end of the webinar, I'm going to pull in this link to an evaluation tool. So you can see that here. I'll pull it back out. And we would really appreciate your feedback regarding the nature of the programming, etc. If you all have any questions or thoughts, you can use the chat down below the presentation there. And so with that introduction, Courtney, thanks again for doing the webinar and being here, and I'll pass it off to you.
Great, Mark. Thank you so much. Can you hear me okay?
Yes.
Wonderful. Great. It's always nice when the technology works. Hi, everybody. Thanks for joining us today. I appreciate that introduction. My name is Courtney Cuthbertson, and as Mark mentioned, I'm a community behavioral health specialist for Michigan State University Extension. And what I'll be sharing with you today is what MSU Extension's response has been to the opioid crisis. So I will share a little bit about what we know about opioids, opioid misuse in Michigan. I'll then share about the framework that we use to think about opioid addiction, opioid misuse in the state through Extension, and then talk about what we've done as MSU Extension to address the issues that we've identified. If you have questions, please feel free to write those in the chat box at any time. I'm happy to answer those as we go along, or at the end, either is fine. So what do we know about opioids in Michigan? We can see here, this overall graph is about the rate of opioid overdose deaths. So what we see, the yellow line here represents Michigan. The orange line represents the opioid overdose death rate for the United States on average. So we can see that in 1999, there were fewer than 2 opioid-related overdose deaths in Michigan, which seems to be about half of that national average. And we can see going along here that somewhere around this 2005 to 2010-11 period, Michigan was tracking just about the same as that national average. And then in 2013, the rate of opioid overdose deaths in Michigan started trending up much higher than the national average. So we know that over this period of time, if we look at the data from that 1999 to 2016 period, that opioid overdose deaths went up over 5 times in the U.S. When we look at Michigan, we know that the opioid overdose death rate from that same time period went up 17 times. So we have quite a big issue here in Michigan, and we can take a more specific look at what this is like geographically. I mentioned already that we know that opioid overdose deaths in the state have increased over 17 times. The most recent statistics that I've seen show that 115 Americans die every day from opioid overdose, and we know from the numbers that 6 of those 115 are in Michigan. This makes us the 11th highest age-adjusted opioid overdose rate by state in the country, so 11th in the nation. And we know that in 2016, there were more Michigan residents that died from drug overdose than car accidents and homicides combined. So this is a very big impact in the state of Michigan. And we can see the map on the right over here is really breaking this down by county level. So we can get an impression of where we see more opioid overdose deaths. And I'll point out the county right here. This is Muskegon County in Michigan, and the recent media attention and looking at statistics for this county showed that there was about 1 heroin overdose every day in Muskegon County. So we have some areas in the state where we know they could really use some help. There's some things going on we might really be able to impact. In addition to opioid overdose deaths, we can also think about the rate of opioid prescriptions. So this map is a little bit different. Instead of opioid overdose deaths, this is looking at the rate of opioid prescriptions per 10,000 residents. And we can see, if we remember from the map that was just shown, that this doesn't quite match on to where those overdoses are taking place. What we know, more of the urban areas of the state are further south. So we've got Lansing, Detroit, we also have Grand Rapids here. Flint is over here. So we can see that it's more of the rural areas of the state where we see the higher opioid prescribing trends. So more of this northern Michigan and some of the upper peninsula here. And that tracks on with national trends. And national trends have also been showing that there are higher rates of opioid prescriptions in rural areas. We know based on the data that we can see from Michigan that Michigan has the 10th highest per capita prescribing rates for opioid pain relievers. In 2015, we had about 115 opioid prescriptions per 100 people, so clearly that's more than 1 prescription per person. And in 2016, the data have shown us that there were enough prescriptions for every resident to have over 80 doses of an opioid painkiller. And we really look to this data first to try to understand the scope of the problem that we're talking about. So we hear a lot in the media about the opioid crisis. One of the first things that we did with MSU Extension is try to get a grasp of what this problem looks like. Where is it a bigger issue than in other areas, and what other factors in those more specific geographic areas might be playing a role when we're thinking about opioid overdose deaths, opioid misuse, and other similar issues. So what's the framework that we're really using to think about the opioid crisis? A lot of people have talked about substance use and opioid misuse as a really individual problem, and oftentimes, at least when I'm seeing the media, people have a conversation around poor decision making, that this is a moral problem, that people just need to make better choices. Rather than using a moralistic framework, we really use the socio-ecological framework or socio-ecological model, also called the social ecological framework or model. And instead of just seeing that individual by themselves, we see the individual as nested within parts of broader systems, including their relationships to other people, organizations, communities that they are a part of, and broader society. The social ecological framework is a very popular theoretical model used for many different public health interventions. We know that it has been adopted by the Centers for Disease Control and Prevention as their primary framework. The different layers in this framework are assumed to interact and potentially to reinforce each other, which can lead to differential health impacts depending on individual social location, things like age, gender, race, class, right? And we know that it can also depend on the layers in which people are embedded, the different community factors, the different things that might be specific to those rural northern counties in Michigan compared to rural southern counties in Michigan or urban counties in Michigan. The social ecological framework has been used to address and understand many different health topics, including physical activity, nutrition, diabetes management, bullying, caregiving to children with cancer, tobacco use, cannabis use, and driving under the influence, as well as alcohol use. So we can see that there are many instances where the social ecological framework has been used to think about what those individual health outcomes are when we look at those different levels that could be impacting that individual, their decision making, what they have access to, and what's going on generally around that person. So what has MSU Extension done related to the opioid crisis? The first thing that happened within MSU Extension was this creation of the Community Behavioral Health Group, which is a core group of folks who will really be attentive to what's going on with the opioid crisis and coming up with creative solutions for what we can do. So the goals of this group, first, to be responsive to mental health and substance use needs across the state. Second, to promote and build behavioral health literacy among Michigan residents. So when I say behavioral health literacy, I'm really referring to three separate components of that. So one component of behavioral health literacy is the knowledge that people have about what mental health and substance use look like. What are those signs and symptoms that we might be able to look for to recognize that someone might be experiencing a crisis related to mental health or substance use? So that's the first part of behavioral health literacy. The second part of behavioral health literacy, as we see it, is really related to those help-seeking behaviors. So how much can we help someone who's experiencing a crisis to connect to resources that might be able to help them? Or how much are we able to endorse help-seeking in terms of statements and behaviors, different things in that nature? And the third component of behavioral health literacy is really about lessening stigma, making sure that folks in Michigan communities know that it's okay to not be okay. And that when people don't feel well, it's okay to reach out and ask for help and break down that stigma, really to try to help people to get help when they need it and to have some real conversations about how we can enhance communities so that we don't run into these same issues in the future. Or if we do, we know what to do. Third, so I mentioned those were the three areas of behavioral health literacy. We're working on promoting and building that among Michigan residents. The third goal of the Community Behavioral Health Group is really to raise awareness and promote community involvement in addressing the opioid crisis. And I'll talk more about that as I mention the other things that MSU Extension has done. But the first part here was really about establishing this group of people to pay particular attention to what's going on with mental health, substance use, and specifically the opioid crisis, and come up with those creative solutions. So we are working on a series of fact sheets that are freely available on our website, which I will share the link to at the end of the presentation. This is the first in the series, 5 Things to Know About the Opioid Epidemic. So this shares just some general background information, similar to what I have shared already about there being 115 people in the United States who die every day from opioid overdose, and 6 of them are in Michigan, to share what some of those signs and symptoms are. If someone is experiencing opioid misuse or opioid overdose, what are those things that we would look for that we would know that that's going on with that person? The other components that we included in this fact sheet are personal things that people could do to be able to take action to lessen opioid misuse. So an example would be that folks could safely store their medications by locking them up instead of leaving them out in a medicine cabinet or in a sock drawer or wherever they might be left. So we also encourage folks to have conversations with their healthcare providers if they're concerned about a family member, friend, or themselves related to opioid misuse, and encourage folks to really work on breaking down the stigma and having conversations in their communities about opioids and their impacts. And with all of the materials that we're working with and creating, we do work with the best available evidence. We're doing extensive literature reviews to make sure that we have the most up-to-date information and that we are sharing information based on what research has shown. So We've created several fact sheets. The 5 things to know about the opioid epidemic is currently available on our website, and we'll have more coming soon. Another thing that we've done is participate in different health fairs and opioid town hall events. So an example of a health fair that we attended, the Michigan Farm Bureau held an annual meeting with a health fair associated with it. We were able to host a table there. We also have been able to host tables at a Muskegon County opioid town hall event that had a number of speakers from the community. And the pictures that you see are of our display that we travel around with and take with us. And we have borrowed this idea from Ohio State University Extension. And you can see there's a medicine cabinet, and there are about 16 different pill bottles. And I'm not sure if you're able to see on the close-up picture, but each of the pill bottles has a question about the opioid crisis on the outside. The inside of those bottles contain the answer to the question. So we get a lot of comments about this. People are very intrigued to see a medicine cabinet when they come to these types of events, and we get a good number of people who interact with it and seem surprised about the information that they learn. We also have been going around the state and providing presentations about opioid misuse, and those include some of the similar things that I described from the fact sheet, but in more depth. So, what are the physical effects of opioids on the body? What are the signs and symptoms of misuse? How do we even define what misuse is? We also, in those presentations, take a look at what the trends are nationally and within Michigan. And we engage conversations about what we can do personally as one person. What can I do to lessen the impact of opioids and opioid misuse in the community? And then in our communities, as groups of people, what can we do? How can we work together to try to lessen the impact of opioid overdose and opioid misuse? So again, the participation in the health fairs and then giving those presentations. And those presentations have varied from 20 to 30 minutes to an hour long. We go based on the requests that we receive from partnering organizations. So in one instance, we partnered with a local substance use prevention coalition, and that was about a 30-minute format. In another instance, we were asked by a behavioral health provider to give this presentation for some of their folks, and that was about an hour long. I see Mark's question of how many people come to these events. That's a very good question, and it can vary. So with the health fairs and town hall events, those can be anywhere from 100 to 300 people who attend. The presentations that we've given have also varied, anywhere between 20 and 75 people in attendance. So you get an idea there of the reach for these events. What else has MSU Extension done? We were trying to think outside the box in terms of how to get people in the door, because at least in Michigan, there does seem to be a moderate or high amount of stigma related to opioid misuse. We know that in Extension, we have some more traditional formats of education where we might ask someone to sign up to take a class for 4 or 6 weeks. And we thought, we're not sure if we'd be able to get people to come for that long. So what's something that we could do where people would feel like they could come and they wouldn't feel necessarily put on the spot, but they could ask questions if they want to. So we came up with the idea of doing these opioid documentary film screenings. And instead of just having the film and then letting people leave, we do want to make sure that there's a discussion in the end so that we can be on the same page and learn together about what opioid misuse looks like in each of the communities where we've been working. So we have worked with local coalitions to put on each of these screenings. We've done 3 screenings of the documentary called Warning, This Drug May Kill You. That documentary was produced by HBO, and it came out about a little over a year ago. It follows the stories of 4 families who are struggling with opioid misuse or have lost someone to opioid overdose death. And in each of those screenings, we've recommended that the audience be aged 13 and above, and that anyone under 18 come with an adult, whether that's a parent or guardian, someone who they can talk about the film with even further after our panel discussion. with those screenings of warning this drug may kill you, we have made sure to have available some of our 4-H youth educators in a separate room from the event so that parents who are in need of childcare can bring their kids with them, and the kids are involved in some programming related to healthy living. So that might be about healthy decision making or other similar things that would kind of be thematically aligned with the general event. The audience for these events, thinking about Mark's question from the previous slide, has been anywhere from 30 to about 65 people coming to the screenings. We also did one screening of Chasing the Dragon, The Life of an Opiate Addict, and this one is produced by the FBI. There are actually two versions of this film. There's the general version, and then there's another version of this film that's meant for youth. So we used the youth version and presented that to a group of young people and had a conversation afterwards about what they noticed from the film, what did they pick up, what really seemed important. And some of the youth said that the narratives that were shared in this film sound like, these are normal, everyday people and that end up experiencing an opioid addiction, and that was very surprising to some of those young people who attended that screening. So we have hosted these 4 screenings. I believe that Chasing the Dragon is a free film to show, having been produced by FBI. Warning This Drug May Kill You does have a cost associated with the screening, and that cost will vary depending on the audience size, depending on the venue, and maybe a few other characteristics. So we worked with Swank Production, a company, to be able to put that on, and we also worked with those local coalitions to secure the space to be able to show the film. In some cases, we were charged for that, and in some cases, the space was donated. So I've talked a lot about the films with this, but I've talked less about those panel discussions. So the panel discussions included panelists from a variety of different backgrounds. We really wanted to make sure that the audiences were able to hear from people who had diverse perspectives and experiences. So our panelists included folks who were in recovery, so meaning people who had experienced opioid misuse and were currently not misusing opioids. We also included surviving family members, so folks who may have lost someone to opioid misuse or overdose. We had representatives from Families Against Narcotics. We had some doctors present at some of the panels, as well as mental health professionals, substance use professionals, prosecuting attorneys, and police. So we really, again, try to get a lot of different backgrounds to get those various perspectives represented on the panels. So the questions the panelists would answer would often come from the audience members. We also did prepare a list of 10 questions for the case that the audience wouldn't have questions. Some of the things the audience was concerned about were how to get access to naloxone or Narcan, an overdose reversal drug, and what's the shelf life of Narcan or naloxone. Another question that has come up from audience members was about racial disparities. So a question around the way that opioids are talked about, seeming that if we look historically, that now that something has become more of an issue for white populations, we're talking about it in terms of health. So could the panelists speak to that? And we've had very good conversations with those audience members about that. I see a question here, are the films available for us to view? I think that if you went online and searched for Chasing the Dragon, I believe that that one is available to screen online for free. Warning This Drug May Kill You, I mentioned that's an HBO film. So if you had HBO Go, you would likely be able to view it. I believe that there might be even trials of HBO Go that you could sign up for to be able to see the film. Warning This Drug May Kill You is also available in a DVD copy online, so you might be able to find it that way as well. So we have done 4 of these opioid documentary film screenings. We did go through and view many other documentaries to try to think about what the best fit is. And the reason that we've picked these 2 is really about the way that they frame the issue of opioid addiction and opioid misuse, and also how long they are. So I know that PBS Frontline has done a couple of different specials. Those ones are, I believe, between an hour and 2 hours long, and we were very concerned about audience fatigue, and we wanted to make sure that people stayed engaged. So we picked these two because of the content and also length considerations. So what else has MSU Extension done related to the opioid crisis? We are offering more and more mental health first aid trainings, and we are starting with educating our own staff, our own extension staff. In the mental health first aid program, participants do learn those signs and symptoms of mental health or substance use crisis, how to talk to somebody who is experiencing a crisis, and refer folks to appropriate services or resources that could help them, in addition to breaking down stigma and learning about how to do that. The National Council for Behavioral Health that controls the mental health first aid training has recently added an opioid response supplement that adds specific information about the opioid crisis to the training itself, and part of that is looking at some general background information about the crisis at a national level. It also includes a video related to use of naloxone, how to administer naloxone, and then again those signs and symptoms. What does a crisis look like related to opioid misuse, and what do we do? The evaluations that we have from the MSU Extension mental health first aid trainings show that 100% of the participants say that they're more confident in recognizing those signs of a mental health or substance use crisis. 98% are more confident in connecting someone to resources. 90% are more confident asking someone if they're considering suicide, and 94% are more confident in recognizing and correcting misconceptions related to both mental health and substance use following the training. So because of this training, those are the impacts that we see, that people are more confident in all of these areas that the training covers. The mental health first aid training, just in case folks are not familiar with that, it is an evidence-based program that was developed in Australia in 2001. It came to the United States in 2008. I believe it's in 23 different countries in the United States. There's over 1 million people who have gone through the training. And I think we can probably find the website for mental health first aid to share that as well if you are interested in finding out more about that program. Through MSU Extension, I mentioned that we've been doing these trainings. I am a certified instructor for both the adult and the youth versions, and we have gotten a few other folks trained to be able to deliver these sessions as well. So the mental health first aid training for adults focuses on what those signs and symptoms look like for adults. And the mental health first aid program for youth is actually still for an adult audience, but it's about identifying those signs of crisis in a youth population. So Mark has a question about the cost of becoming a certified instructor. All of that is controlled by the National Council for Behavioral Health, and the most recent numbers that I've seen is that there is a $2,000 fee to sign up for the training. There is an application process, so you'd have to fill out an application. Then there's the $2,000 fee, and the trainings happen all over the U.S. So when you're doing the application, it'll ask you what are your priority areas. Would you prefer a training in this location or that location, and you can select. So the other costs affiliated with that would be travel to the site and lodging over that time period of being there. And the training lasts for 5 days, or one business week, I guess we could say. So MSU Extension, in response to the opioid crisis, has implemented mental health first aid training. We are working with communities to offer this. We are making sure that we're training all Extension staff to be able to have conversations with folks in communities about this very issue, and reach out to folks who might be in need, help to connect them to those different resources. Okay, I see the question, besides your initial MSU fact sheet, what other printed resources might we borrow and distribute during our Colorado Agribility workshops with farmers and ranchers with functional limitations? Thank you for this question. So I didn't include this because it wasn't part of the response with opioids, but MSU Extension has also been doing a series of workshops about communicating with farmers under stress. So there's one workshop that is communicating with farmers under stress that's meant for folks who support farmers to know what are signs of stress, what are the types of things that I should say, could say to farmers and ranchers who might be in stressful situations, and how do I connect them to resources. There's also the Managing Farm Stress workshop that is meant for farmers and ranchers specifically to be able to talk about what stress looks like, identifying it in oneself, and then again knowing about what those resources are. The Managing Farm Stress class we have also created an online component for, so farmers are able to go on in their own time. I believe that it can be completed in one session if someone wanted to spend about an hour online. Or people can come and go as they please into the system. I know that there are some printed resources. There is a postcard related to that online course. There's also a handout about, I believe the title is How to Cultivate a Productive Mindset. So I believe that's available on the MSU Extension website. I can get the link for that and I'll let you know, and that's definitely something that you could distribute during your workshop. Thanks for the question. And that's actually all that I was going to talk about in terms of MSU Extension's approach to the opioid crisis. We are working on a few other things, and as we have more information available, I'm happy to share that. Are there any other questions?
Thank you, Courtney, for sharing all of this information. I see we have at least one more person typing in a question. I want to just remind everybody that we are really appreciative of your feedback regarding the information that Courtney provided. Also, on May 30th, we will have a webinar specifically on mental health first aid, so you can learn more about, more detail about that program next week.
So I see two questions. I see one here, can we use our state logo with MSU on printed materials? That I would have to refer back to my communications department to check in with them. Please send me an email and I can follow up with you on that. Another question here, would you recommend the mental health first aid program to just anyone? Actually, I would. The program was intended for a general community audience, and it's intended to give folks a background in just about what mental health is, what substance use is. And what I say sometimes when I'm doing the program, I ask folks, how many of you have taken a CPR class or a physical health first aid class? And there's usually a few hands that go up. When you're done with that class, do you become a surgeon? And people laugh and say, oh, no, we don't, you don't become a surgeon. So it's the same thing with mental health first aid. We become someone who helps. It's not to become a mental health professional. It's not to become a therapist. It's an 8-hour training program that can be accomplished in one day or split over 2 different days, 4 hours each. But it's really meant for general community members to be able to learn more and to be able to reach out to others who might be needing help. I should also note the Mental Health First Aid for Adults program can be specialized somewhat to different audiences. So they have a module that is for rural populations. They have another one for older adults. They have another one for higher education. Another one for fire and EMT, another one for public safety officials, which I think is typically police officers who would go through the training. So each of those modules really help to tailor the program to people who fit into those audiences. So the higher education module, for example, would have some information and data included about what trends are among undergraduate and graduate students, and really make more specific some of the different activities to the conditions that that population might experience. So I would say, yes, I would recommend the program to anyone. Christine, thank you for sharing that quote from the Mental Health First Aid website. Anyone, anywhere can be the difference for someone facing a mental health or substance use challenge. I see another question. Have you encountered any resistance to Extension being a resource on this topic? I don't know that I would describe it as resistance. I've heard some hesitation, and the hesitation that I've heard is some folks would say something like, "Well, opioid addiction, that sounds like a clinical issue that someone should deal with their healthcare provider." And my response to that is, yeah, opioid addiction is something that could require some professional treatment, and someone could benefit from talking to a healthcare provider. Even with that in mind, there are a lot of different aspects of a community that we might be able to think about that could help folks to get help when they need it, or could make the circumstances different so that folks maybe don't go to misusing opioids, or they're less easy to access. And I think about that educational component. In my experience, Extension is all about that educational process, and there are so many different health issues that Extension is able to provide those educational opportunities around. So I provide the challenge of this. To me, is another health topic where we're able to provide leadership and education for community members. Thanks for the question.
Well, I don't see any additional questions coming in. Courtney, again, thank you very much for providing this really great information and the resources. And they can contact you. Is that okay if they have additional questions or like follow-up?
Yes, absolutely. Thank you so much for the opportunity to share with you today about what MSU Extension has been doing. If you have more questions, please feel free to reach out. My email address is there. I'd be happy to communicate with you.
Okay, great. Thank you. We will also be posting a recording of this webinar, so if you'd like to share it with others, you can. The survey information is available on the original link on our NCRCRD website. And then we have a number of additional webinars, 2 webinars on May 29th at 1 p.m. and 2 p.m. The first one is looking at life skills training and Generation RX. And then we also have the mental health first aid on May 30th. And then community assessment to promote behavioral health planning and evaluation on May 30th as well. And then finally on June 1st, we have Strengthening Families program. That's at 2 p.m. Eastern Time. And then finally, this is a date to be decided for the Prosper program. So keep those in mind, and thanks again for joining us, and we'll sign off for now. Have a good afternoon.
Thanks, everybody.